mobility here where I didn't have it a month ago, and I haven't had it since I was, I don't know, 16. Probably on a week to week basis, I was feeling different levels of results. And
Mhm.
then probably about, I would say like 2 months in is when I started visually seeing things where I saw like, hey, I'm developing muscle where I've never had muscle before.
We talk a lot about people being just millimeters away from pain or from function.
So, like, I've been overwhelmed by all of the different things that are out there that can, claim to help you with your pain. And I just know from personal experience and having tried a whole bunch of things that it didn't work for me. And this is the first, like, working with you, and this program has been the first thing that's actually addressed some of my issues in a way where I felt like, yeah, this is actually addressing it.
Hey everybody, it's Angela from New Vision Health. And in this video, I'm going to introduce to you Mariam, one of our clients. Now, when Mariam first came to us, she knew that she had issues in her body causing nagging joint pain that she could overcome if only she could just piece together what areas specifically in her body needed training and release. But she was bogged down in the vicious cycle of maintenance care with other types of programs and therapies, and not really getting any real solutions as to how she could resolve her aches and pains on her own. But in just 2 short months of working with us, Mariam was able to rid herself of nagging right side pain down her leg and back. Now, I don't want to spoil all the details, so I'll let Mariam tell you for herself just how she did it.
So, Mariam, if you could just introduce yourself, tell everybody a little bit about yourself. What are your hobbies, interests, what you do for work?
Okay, yeah, sure. My name is Mariam. I am a business management consultant by day, and by night, I like being involved in community theater. I especially love musical theater. And I guess some of my hobbies are varied. I like sailing, I like hiking, I like just relaxing by the ocean on a beach. So I have a lot of different hobbies.
Awesome. Yeah.
Yeah.
So can you describe to us what situation you were in before you joined the New Vision Health coaching?
Yeah, for sure. So, the situation that I was in was that I was feeling like some of like the physical activities that I had done in my 20s and my early 30s were really catching up to me in my body. And I had chronic pain in my lower back. And I had tried a whole bunch of different things to try and address the issue, like massages and yoga and different stretching, or even just workout programs like kickboxing or lifting to stay healthy and stay vital. But nothing was really getting at the root of the issue. And my pain just wasn't going away. And so I had sort of built a life where I was managing around my pain, but I was in constant discomfort.
Okay. Yeah. So I guess my next question would be, well, as you mentioned, you already participated in a bunch of different programs, tried a bunch of different modalities, and everything does have its place. But there's just so much out there in the fitness and rehab space that, really claims to help people with joint pain, or with their performance. What was it specifically about the New Vision Health program that made you want to take part in it?
Yeah, so two things. I think the first thing was that I just really liked you, Angela, and I really liked your vibe, and I wanted to work with you. And then the second thing was that as like when I came to my first session with you, we had a conversation about the triangle that I can't never remember the name of it, but I think it's the pyramid of function.
You got it. Yeah.
Yeah, okay. So we talked about that, and we talked about how like a holistic way of caring for your body. And that was the one thing that I think was really different from anything else that I've done. That was really attractive to me because I really believe in like our body, taking care of our body and like physical movement, but then also like how are our behaviors and emotions and like psychological well-being, like how is that also affecting our bodies and like how all of those things work together. So I think like your holistic approach was really attractive to me, and it was something honestly that I think was missing from everything else that I've done before. So that was like the second main reason that I wanted to go through with this program.
Yeah, okay, that's really lovely. Yeah. Well, and like you mentioned, the pyramid of function, it's all about integrating all the different facets of health. A lot of times there's so much focus on just nutrition or just strength training or just stretching and mobility or just rehab protocols like different tissue release methods. And yet all of those things need to work together on some level and work together for the individual. So as you got into the program, you probably noticed there was a whole ton of information in the membership portal. But with that and alongside the coaching sessions that we did together, was there anything in particular that you found really helped to get you out of pain within the program?
Yeah, I think the very specific way in which you met me where I was at when we first started training was probably key, right? Like, I think you paid a lot of attention to my like physical ability to do the things that you were saying, but then also like through our training, we found let's call them like weak spots. I know that's maybe like not the best term for it, but like areas that I needed to improve. And so like identifying those and then the way that you tailored what I should be working on a day-to-day basis outside of our training sessions, I think that really helped with helping me to get out of pain. And really it was simple things, right? Like just thinking about my posture, like we had a really fulsome discussion about what does it actually mean to have good posture and how can I work on it through and like change my behaviors on a daily basis so that my posture improves, right? And it's this idea that we have about like holding your shoulders back and chest out, like that's just so I think dated now that I
Yeah.
know everything that we've worked on together. But yeah, it was just like integrating those like small day-to-day things into my life made the biggest difference, and it sometimes it's like we're looking for that one thing that like yes, that like this is what I'm going to do, and it's like a big action that leads to a big response. And it was the little things, the digestible day-to-day things that I could do.
Awesome, yeah. And that's where the work is very much about attention to detail. You probably felt that that's one major difference to maybe traditional training methods, where
Yes.
there's a very macro focus on the body, but almost like we're missing the little details and all the little pieces that build into those macro movements. Um,
Yes. Yeah.
yeah, so when you were
Yeah, totally.
mentioning about doing or you're just carrying into your daily life and thinking about posture and your behaviors in your daily life, are there some examples that come to mind for you in that?
Yeah, I think one of the very first things that we talked about was the standing neutral, right? So, how to stack your body properly, ribs on top of hips, and then legs and like everything, head to toe, right? And one of the very first conversations we had was about just thinking about these things when you're having a conversation with someone at a grocery store. And I had never thought about this, but through our conversation, and like I reflected on like, yeah, what am I doing when I run into someone? Like, what's my body doing when I run
Mhm.
into someone at the grocery store? And I tend to like lean to one side or just like, like my hip tends to go to one side and I'm just leaning, and challenging myself to not do that. So when I'm speaking to someone, just like really making sure my weight is balanced and I'm thinking about how my body is stacked. And it was just such a simple thing, but like it changed the way that I moved for that week,
Mhm.
just bringing awareness and really listening to my body, but in a very like structured way. Like I knew what I was sort of feeling for as I
Mhm.
was having those interactions. And yeah, like that, I think that was the first thing that kind of sold me on it. Because I was like, yeah,
Cool.
this makes a difference. Here's a really small thing I can do. Here's a really small part of my life that I can bring awareness to that can lead to like bigger, longer term changes.
Okay, yeah. And I love what you say there, being able to feel more or bringing
Mhm.
in felt awareness, because that's a large part of it is we have often the potential in our muscular system, but we don't know how to communicate with those areas of our body and actually engage them and use them. And so we often just go around totally like bypassing those areas completely, whether that's in our work or just any position we find ourselves in our day, standing, walking, running, or any work that we have to complete in the day. We just bypass those muscular chains because we don't know how to feel into them or how to actually activate them. But once you do, it's the little things that you can start to bring into your day, like yourself, just standing at the grocery store. All of a sudden, you're able to actually make standing at the grocery store an opportunity to get out of pain rather than having to spend a 60-minute workout trying to unravel everything. Hmm.
Yes, yeah, exactly.
All right. Well, now that being said, you mentioned that you had tried a bunch of different rehab and training methods, and specifically to get out of pain and discomfort because you lead such an active life. You like to hike and dance and do activities that are quite physically demanding. And so, as you were trying to embark on that journey and get out of pain through those other methods, like what successes did you have in doing that? Were there successes, or were there maybe some failures, or maybe just some plateaus? What was your overall feeling when you were going through all those different modalities?
Yeah, I think one thing that was common, so like just to recap, I've done a whole bunch of things in my life. So I've tried hypertrophy type training, I've done heavy lifting, I've done kickboxing, and of course I love dancing. I've danced since I was in high school. And on like the more like not really like working out, but like working out type world, I've done yoga. Like I was a big hot yoga junkie. Used to do that lots. And I mean, in terms of massages and stuff, I've probably done like different types of massages, like all of them. A deep tissue, a hot stone, cupping. I used to do Thai massage pretty regularly too. I've seen chiropractors. And I guess like the common theme with all of these things is that I was hoping to find a mix of modalities that would, one, leave me feeling like vital and I could go through my day to day without pain. And I was also trying to like be my best self, right? Like maintain my weight, but also like have a good amount of muscle mass on me. So like maintain fat, have good muscle. And I guess like regardless of the mix of things I had going on, because I wasn't doing all of those things at the same time, right? Like chunks of my life, I was focusing on different things. And regardless of the mix of things that I had going on in my week, so let's say I was kickboxing and doing yoga, right? And like 2 or 3 times a week, that's what was taking up my time. I never really felt like I had the same kind of head to toe body awareness or like getting to the root issue of my pain and discomfort that I was feeling. Like I just never really got to any of the root causes of what was going on in my body and like building sustainable change. And like that's not to say that all of those things are bad because like I still like I love going to a yoga class, right?
Mhm.
I'm still gonna dance because I love dancing and it's part of like my evening hobbies, right? But I think I'm just approaching them differently. I have a different relationship to them. So I'm not looking for yoga to get rid of my lower back pain, right? I'm going because like I just like doing it. And there's a spiritual
Mhm.
aspect there for me that's still
Mhm.
important. But yeah, I think I was just like reaching for all of these things, hoping that some of my issues would get solved, but they didn't.
Yeah, exactly. So
Yeah.
that's wonderful, though, that now you have tools and techniques and an awareness of how to solve problems in your body more than you did before. And so that helps put everything in the appropriate place so that you can still participate in the hobbies and interests you had and have, but now understand how to actually resolve your pain problems when they're happening, and enjoy those hobbies for what they are, and enjoy them because you're not in pain. But
Yeah.
then know how to train appropriately to actually effectively get out of pain, and not need to be in that vicious cycle, which we harp on a lot because we so deeply want people to want their therapies, not need them. And there's a big difference between needing something just to function versus wanting it because you like it or enjoy it or it gives you stress reduction or a whole multitude of benefits that come from those things, but don't often get you off the vicious cycle of actually getting to the root cause of your problems. Mhm.
Yeah. Yeah, totally.
So, with all
Yeah.
that being said, one of the most common questions we get is how long does it take to get results? And so, for yourself, how long did you find it took in the program to start seeing some real results, seeing or feeling?
Yeah, I think I started feeling results pretty quickly because I approached the program with like, I was in a place mentally where I was just really committed to it. And I wanted to get the most I could out of it. So in our sessions, I was just like really listening to you and like really trying to self-reflect and integrate everything that I was learning into my day-to-day life. So I would say like probably within the first week or so, I felt different. Like when we talk about like our standing neutral and how to integrate it into our life, right? I started doing that, and like right away, I was like, okay, something's going on, something's different. And I guess when we talk about results too, for me, probably it's something that results are not like that visible, right? Like I didn't suddenly lose 20 pounds or like
Mhm.
I didn't suddenly put on 20 pounds of muscle. So, but like the things that I was struggling with was like the symmetry in my body, right? Which was probably contributing to some of the pain that I was experiencing in my back. And so, like, gaining more symmetry in my body probably happened, I'm not really sure, but like a month and a half of training or so.
Mhm.
But like in those first, I would say 4 to 6 weeks, I definitely felt results in terms of like I knew I was standing better and I knew I was sitting better, and I felt like the investment that I was making in terms of like our training on a week to week basis was just opening things up. Like my hips were really tight, and then suddenly I was like, oh, I've got mobility here where I didn't have it a month ago. And I haven't had it since I was, I don't know, 16. So yeah, it was just like it slowly compounded, and it was probably on a week to week basis. I was feeling different levels of results. And
Mhm.
then probably about, I would say like 2 months in is when I started visually seeing things where I saw like, hey, I'm developing muscle where I've never had muscle before. Yeah.
Yeah, awesome. That's really wonderful. Yeah, and we talk a lot about people being just millimeters away from pain or from function. So often, yes, when we're talking about visual changes in the posture, initially, these things can be very subtle that, aren't necessarily obvious to the untrained eye, but of course, we help train you to start to see those subtle differences and look for them in your own body. But with time, you do start to see your structure come alive a lot more. And in your case, you actually have shown a pretty impressive before and after for just a few months of training. How did you feel about those results visually?
Yeah, it was really cool to see those results, because I guess because we had taken before photos and then we trained for a couple of weeks, and I really wasn't thinking about my before and after at all. I was just taking it like one day at a time, one week at a time, one training session at a time. And it was really cool to see those results. It was so motivating, and it was so validating because I knew that I felt different. And the way that we took the before and afters was like I wasn't really able to see those kinds of results the way that you would in a photo. So it was just really validating because I knew I was getting better and the photos just like proved it. And it was also really motivating because I was like, yeah, let's just keep going because I know this can get better, you know?
Mhm.
So it was really exciting.
Awesome. Yeah. And yeah, we always want to take pictures because as we're progressively improving in our body, it's almost subtle and you don't even notice that you're improving. And then you look back and you're like, wow, I actually
Yeah.
did gain a lot more. You're living in your body every day. So it's almost hard to see the visual changes until you look back.
Yes,
Um,
exactly. Yeah.
but yeah, so for you, you know, chronic lower back pain, I think as well dealing with some right knee pain. One, can you just explain a bit how that was affecting your life? Just that pain building up, and then how long did it take for you to feel a pretty drastic reduction or elimination of the pain?
Yeah, so I think when we first started chatting, one of the first things that I mentioned to you is that I don't know, Angela, I don't know what's going on, but like I know the whole right side of my body is just off, right? My right knee, I have a history of like if I go for a hike, an hour, hour and a half, is kind of my max. And the day after, and like usually for a couple of days after, my right knee is just like screaming at me, right? It's in a lot of pain. It's difficult for me to sit, stand, go downstairs. That was really annoying and like would really aggravate my knee. And again, like my lower back on my right side, I couldn't sit for a really long time. And because of my work, I actually need to sit at my computer.
Mhm.
And if, you know, like if I'm in a situation where I'm at my stand-up desk right now, but if I didn't have that around, it'd be really difficult for me to sit for an hour, hour and a half and just like really focus and get some work done. So yeah, it kind of felt like it doesn't matter what I'm doing. If I'm walking, I'm hurting. If I'm sitting, I'm hurting. If I'm standing, I'm hurting. So it was just like a constant struggle to get stuff done and just live
Mhm.
my day to day.
Mhm. Okay.
Yeah.
Yeah. So, and then did it, how many weeks or how many weeks until you start to feel that pain go down?
Yeah, so the second part of your question, which I forgot. It probably took, you know, I would say about a month for me to start noticing,
Okay.
yeah, for me to start noticing that my back was doing better. And yeah, so there was two things, I think. The first thing was I started to notice that my back is not hurting, and it almost went away, and I didn't realize it until like in a session, I think you asked me, and I was like, "Oh, yeah, like my back's not hurting. It's gone." Yeah, and I think that must have been about a month in. But then the second thing was, you know, I started noticing what like what I'm doing in my day-to-day life that's aggravating my lower back
Yeah.
pain, right? So then I
Hmm.
think as the weeks went on, I was able to manage those behaviors a little bit better. Yeah, so that yeah, I was just slowly working towards less pain every
Great.
day.
Yeah. Yep.
Yeah.
So really, I mean, for you dealing with that pain for several years and then within a month to make such progress, it's really, really amazing. And then also kudos to you for because you really put the work in. You really embraced the program. You showed up to your sessions. You kept an open mind and you kept exploring and were very willing to look at your behaviors, which is a tough part of the journey, but a very rewarding part once you start to come to terms with where we can make little tweaks that can really make a big difference in those pain levels coming down and those performance levels going up. So,
Yeah.
yeah.
Yeah, and I empathize with people who struggle there, you know, because it was really hard. It's really
Hmm.
hard to sometimes look at your own behaviors and see what's not working. You know,
Hmm.
it's a difficult emotional journey. So
Hmm.
yeah, thank you for saying that. It is
Yes,
hard
right.
work. Yeah.
Yes. And as you're mentioning that that's part of it, that behavior change, that emotional tug of war that plays on us, sort of leads us right into just wrapping up here. You know, maybe somebody's watching and they're going through a bit of that emotional tug of war. They know they need to change, but they've tried a lot of things in the past. They're really burnt out and tired and exhausted and frustrated because it's just a vicious cycle and they're not getting the results they want. They're losing confidence. They're not sure if they have the ability to even follow through at this point, or if there's just nothing out there that actually works. So maybe someone's watching this and they're on the fence about possibly hopping on a strategy session with us to learn more. What would you say to that person who is watching this video right now?
Yeah, I think I would say to them that, like, yeah, I know it's hard, it's difficult, and it's overwhelming. And I know, like, I've been overwhelmed by all of the different things that are out there that can, claim to help you with your pain. And I just know from personal experience and having tried a whole bunch of things that it didn't work for me. And this is the first, like, working with you, and this program has been the first thing that's actually addressed some of my issues in a way where I felt like, yeah, this is actually addressing it, not fixing it for a couple of days or fixing it for a couple of weeks, and then I'm back right where I started. So I know all of that stuff can be overwhelming, but I would really encourage people to think about how this program is so different in terms of how holistic it is, and bringing in different ideas when it comes to, like, taking care of your physical body, but also, like, really thinking about what's happening for you emotionally that's keeping you blocked, or mentally that's keeping you blocked from living your most vital life. So I would encourage people to just give it a shot, because I think, like, I believe in it, and I think you and I, Angela, were talking about this a couple days ago. But my personality is that I'm a very critical, like, I'm critical of a lot of things.
Mhm.
So I don't fully buy into things as, like, yeah, this is the thing that's
Mhm.
gonna, like, this is the thing that's gonna solve all of my problems. But the time that I've spent with you, I think this is the first time in my life that I felt like, yeah, this is it. Like, this is actually solving a lot of my issues, and it extends further out into my life. It's not just that I'm feeling better physically, because I'm feeling better physically, I feel like I have better mental clarity,
Mhm.
and, like, all, like, it has actually allowed me to live a more, like, fulsome life. And it sounds really, like, woo woo, but I don't think it is. There's
Mhm.
definitely something real here, because we started off our training, and a lot of the things that we do in our training are real life things, right? Like,
Mhm.
we focus on movement and making sure that our body is, like, my body is moving and functioning properly.
Mhm.
So, yeah, I think I would just encourage people to give it a shot, because I know there's nothing else out there. And I'm not an expert, but, like, I know that in my experience, there's nothing else out there that really looks at you as a whole person.
Yeah. Awesome. Wonderful. Thank you, Mariam.
Yeah, you're welcome. My pleasure.
Wow. Imagine being able to finally free yourself of nagging lower back and knee pain and keep it away for good, while also seeing your body come alive with newfound posture, tone, and energy. Now, if that's something that you'd like our help with, if you have joint and muscular pain that is robbing you from enjoying your time with your family, keeping you from the hobbies that you enjoy, or making it difficult to focus on your life and work tasks, if you want to see if we can help you the same way that we help Mariam, then click the button next to this video and we'll take a look at where you're at in your health journey and what problems you're facing that are preventing you from achieving functional pain-free ability. So click the button next to this video to book a time to speak with us. As always, stay functional. See you soon.